Our skills training is on biases in healthcare. This is basically where we're discuss how different biases affect people within healthcare, how health professionals can affect patients, and how this is really dangerous. So first off, my name is Rizwana. I'm one of the co-ambassadors for the Health Equity Hub. Um, Tanvi, I'm also from Arlington, Virginia. Um,
Okay.
Tanvi.
Hi, everyone. I'm Tommy. I'm the other ambassador for the Health Equity Hub, and I'm from Los Angeles, California.
So we're gonna start off with our table of contents. So first, we're gonna go through with an icebreaker to just introduce this. Then we're gonna speak about the different types of biases, and then we're gonna explain like the science behind bias, and then we're gonna explain different examples that can be seen within healthcare, and then solutions to this, and then finally we're gonna have a quiz to test your guys' knowledge. Um, so yeah, off to our icebreaker.
Sorry. All right, I can talk about the icebreaker for a little bit. So, in the chat, please let us know what you see in the images below. Is paying special attention to the differences in the facial expression of the physician. And please let us know what you guys think in the chat. All right, so like a lot of what I'm seeing come into the chat is right, and is kind of what our theme for today's discussion is going to kind of revolve around.
Okay, so what is bias? Um, Bias is basically people's tendency to think or make decisions based on the assumptions and stereotypes that they are accustomed to or that they already hold in their head, rather than considering the facts or evidence um, present in the situation. And bias can influence how we see other people, how we interpret information, and how we make decisions, which is especially paramount in a setting like healthcare where patient to hospital member interactions really shape the outcome of your health. And learning how bias can affect that helps teach and train our minds to sort of advocate for a more equitable system. Okay, so quickly, before we talk about bias in healthcare, we first need to ground ourselves in the broader context, which are the social determinants of health. The social determinants of health are the non medical conditions that shape health outcomes and access to care. So, in other words, as I said before, health isn't only determined by biology or what happens in the clinic, it's also influenced by the environments that people live in long before they ever see a provider. So, these social determinants influence how people get sick, who gets sick, and how they're treated once they enter the healthcare system. So, to start off, economic status plays a major role. Income can affect things like insurance coverage, transportation, nutrition, whether somebody can seek time, can take the time off work to seek care. And on top of that, education also matters, especially health literacy, which is a main focus for this presentation. As patients who don't fully understand medical information, they can also, like, oftentimes struggle to navigate the system or advocate for themselves to their healthcare provider. Healthcare access and quality vary widely, like provider availability and past experiences. Those things all influence whether someone chooses to seek healthcare. And additionally, your environment is really detrimental as housing quality, pollution exposure, food access, safety, all of these things impact long-term outcomes. And finally, social and community context, including discrimination and chronic stress, has measurable psychological effects. Long-term exposure to discrimination will increase stress and hormones, inflammation, and the risk of chronic disease. So when we talk about health inequities, we're not just talking about individual choices, we're talking about systems that shape opportunity and outcomes. Okay, now we're going to be introducing the different types of biases as there are multiple, and we're going to be breaking them all down.
Okay, so type of bias in healthcare is AI, and while AI can be a really useful tool for doctors and it's helping to like innovate the system of healthcare, it can also have really negative effects on patients and their outcomes. So AI is largely trained on white or Caucasian and non-Hispanic individuals. So when used to diagnose or treat patients, it can insert its own biases and lead to patients not being taking longer to be diagnosed or just not being diagnosed at all and with the correct disease. A good example of this is AI struggling to detect melanoma on darker skin and only be able to detect it on lighter skin tones because that's what it's predominantly trained on. Another big thing to note is that AI cannot account for the social determinants of health, meaning a doctor will work with a patient if they're low income, they struggle with transportation or other factors to help them follow a treatment plan. But on the other hand, AI cannot necessarily do that, and that's why it's so important for doctors to review AI's diagnosis and to not rely on it as much. Another bias in the healthcare system is ageism, which is essentially older individuals being discriminated against when they seek care. A really good example of this is older patients waiting longer for a diagnosis because a lot of times doctors assume that their pain, like joint pain, hearing loss, vision loss, memory loss, is all related to signs of aging rather than diseases. So, for example, if an older person can start developing symptoms of dementia, a doctor may just write that off as symptoms of old age rather than an onset disease. And it's also important to note that ageism can intersect with different aspects of a person's identity, like race or gender, which can cause an even worse experience and again lead to negative patient outcomes in the healthcare field.
Okay, so another important type of bias in healthcare is socioeconomic bias, which relates to a patient's income, education level, or social status. So patients with lower incomes often face limited access to healthcare services. They may have difficulty in finding doctors, affording appointments, or getting transportations to clinics. And because of these challenges, they sometimes receive care later than they should. Insurance gaps also play a major role. So people without insurance or limited coverage often experience higher costs and longer delays, which creates additional barriers to treatment. Socioeconomic bias can also unconsciously occur among healthcare providers. Sometimes doctors may assume that lower income patients won't be able to follow treatment plans, afford medications. Um, and these assumptions, while rare, can also affect the quality of care that they receive. Additionally, preventative services such as screenings and vaccinations, they're often less times like accessible to lower income communities. And for example, a patient with diabetes who has limited income might skip doctor visits or delay insulin refills because of the cost. Um, and this kind of creates like an unintentional prioritization of patients who appear more financially stable. So that's also very important to keep in mind.
So, gender can also play a role in biases. Patients are treated differently based on their gender. There is this gender stereotype that men cannot display emotions and be showing strong, should be shown as being strong instead. And this can cause like less them to be less likely to be offered support because of this stereotype, which harms their ability to get mental health support. Because of this stereotype, men might be a bit more afraid to talk about like their emotions and what they're going through with which can decrease their ability in getting a diagnosis. Heart disease in women is very understudied, so there is a lot of research about heart disease within men, but there isn't that much with women, and this can lead to an underdiagnosis of heart attack symptoms in women in comparison to men because doctors or health professionals might not really focus on it within women, and women might not even realize this. And this is just really harmful because it can delay diagnoses. So, sexual identity can also play a role. Patients within the LGBTQ plus community face discrimination and are treated differently because of their sexual identity. So, healthcare professionals may refuse care to patients in the LGBTQ plus community. Doctors may have less training within trans health, and patients may feel uncomfortable or trust the health professional enough to speak about their sexual health, which can affect getting proper health treatment, misdiagnoses, because there isn't enough information that is being said to the professional. And this is just really harmful because it can lead to higher risks in mental health crises, untreated conditions, and lower trust in the healthcare system. And weight can also play a role. So there are negative stereotypes towards individuals with obesity or a certain body size. Patients are judged based on their body size and weight. Studies found that healthcare professionals, doctors, and nurses reported negative attitudes about individuals with obesity, and this causes patients to feel stigmatized in healthcare settings, which leads to patients being more reluctant in seeking medical care and a delay in treatment. This this is really harmful because it affects um, the patient's feelings, and they may be feeling some form of shame and have a lower trust within with healthcare professionals, and this can delay medical care.
All right, I'll be talking a little bit about ableism. So, ableism is the misjudgment on behalf of some healthcare professionals when they care for patients with disabilities. And ableism occurs when healthcare professionals often overlook the capability of their patients and they may disregard the quality of life of such patients, and that can lead to inequity in their care. They may not be able to pay attention to the fears or concerns that their patients have, and this could cause a lack of communication in many cases, making some patients feeling unheard from their physicians. And these can be mental illnesses or disabilities like Down syndrome, autism, but it can also be physical disability. And patients often need to feel comfortable with their healthcare team as we move towards a happier and healthier future. And now I'll have Tanvi talk about the science behind the bias.
Okay, so now let's talk about where bias actually comes from. So the human brain doesn't process every bit of information analytically per se, and if it did, we would never make decisions quick enough, especially in high pressure environments like healthcare. Instead, we rely on heuristics, which are mental shortcuts that help us make rapid decisions, and most of the time, these shortcuts are very helpful, but they can also lead to certain errors. That's where the concept of system one and system two thinking comes in. So, system one is known as your intuitive system. It's fast and automatic. It operates unconsciously and helps us navigate everyday decisions quickly, but it's also where implicit bias lives. System two is slower, a lot more deliberate. It's also known as your analytical system, and it requires effort and attention. This is a system that we use when we consciously reason or rationalize through a complex clinical decision. So the challenge is that in busy clinical settings, when providers are fatigued, rushed, or overloaded, sometimes system one can take over. So bias emerges from these intrinsic neural and cognitive mechanisms. It's not necessarily about overt prejudice. It's about the automatic associations that can override your rational thinking. And unless we actively pause and engage system two thinking, those biases can influence diagnosis, treatment decisions, and overall healthcare communication. So understanding the science is really important because it's more about taking accountability and raising awareness to the issue. Okay, now we're going to talk about some real world cases where this is actually played out in clinical scenarios. So our first case is in pain assessment. So research consistently shows that Black and Hispanic patients in the US are less likely to receive opioid medications than white patients for similar pain complaints. Racial and ethnic minorities frequently receive insufficient pain treatment compared with non-Hispanic white patients. And this isn't because they experience less pain. It's because studies show that pain perception does not differ biologically in the way these treatment patterns suggest. So instead, implicit biases, including false beliefs about pain tolerance or concerns about misuse, can influence prescribing behavior. And because pain is subjective, providers often rely on judgment. And when system one thinking dominates, these unconscious associations can actually shape treatment decisions. Now, in case two, we have obstetric care. So, in the United States, Black women are significantly more likely than white women to die from pregnancy-related causes. Importantly, these disparities persist across income levels and education levels, and they can't be fully explained by genetics, personal behavior, or socioeconomic status alone. Maternal health patterns show that racial disparities occur across hospital systems and settings. And what contributes to this is the delayed recognition of systems. So when bias intersects with high-stakes medical situations, the consequences can be life-threatening. And these patterns highlight that bias isn't just about individual interactions, but that it's embedded in systems of care. And that's why addressing bias is essential in health equity work.
So, oh,
Oh,
sorry.
now we're gonna take it to Avani to talk about our solutions to this problem.
So, one solution to this problem is the implicit association test, also known as the IAT. It's designed to uncover implicit biases, which are automatic associations people may not consciously recognize. It takes about 10 minutes and works by measuring how quickly you respond to words and images. The idea is that the faster your reaction, the more automatic that association is, which makes it harder to fake or overthink it. The test covers many topics like race, skin tone, gender, age, and disability. So there's a variety of topics that the IET covers. For example, one question might ask how warm or cold you feel toward dark-skinned Hispanic people. And then another example is more reaction based. So in this one, you might be told to press E for bad when you see older people and press the I button for good or young people. If someone responds faster in one pairing than the other, it can reveal an automatic association, even if that's not what they consciously believe. And this matters a lot in healthcare because providers make fast decisions and even small unconscious biases can influence how patients are treated.
All right, so we have a quick booklet prepared for you guys, and I think Donvi's going to share her screen for that.
Yes, I will. Give me 1 second. All right. Mm. Mm. Okay. Yeah. Did everyone see the screen?
Yep. Tanvi, can you maybe explain how to log on?
Yeah, so all you have to do is you just search up Look It, and then you go to play.bookit.com and you can enter the game ID right here, 2252424. I'll put it in the chat with the link if anybody wants that.
Tanvi, I would give it 1 more minute and then
Yeah,
start the game.
okay.
Thank you.
All right. I think we'll get started now. Is that okay with everyone? Okay, cool. So these are just instructions. You can like answer questions. You just click like press on chess and it's whoever has the most gold at the end. So good luck. Just for context, there's like around 3 minutes left in the booklet. So yeah. Actually, seeing as that we're running out of time, we're gonna end the game. So yeah. Okay, so now for the final standings. These are our first, second, and third place winners. Thank you so much to everybody for playing and also for being a part of the skills training. It meant a lot to our hub as one of our first projects, and it was really cool to get to research an issue that we were passionate about and share it with you all. So, just to end this part of our skills training, we just want to leave you all with just be conscious of sometimes what, like, I know you can't control what you think, but sometimes if there's something you feel like you're assuming or making an assumption, try to rationalize and figure out a better way. But yeah, thank you so much.
Fantastic job. Can we get a group photo? And you guys finished pretty much on time. I'm so impressed. Let's get a group photo. And Julie, you're part of this. Everybody just try to show your face if you can. 24 people stayed in there with us, which I'm really impressed. And we had a really good showing today. So proud of you. What a fantastic presentation. Implicit bias is one of the most important things in the world people need to be educated on. You guys did a fantastic job. And our Equality Hub, Julie, has a fantastic presentation too. So we want to get these out. Okay, let's get a photo real quick and then we'll have our mentor meeting. Everybody smile. Okay, wait, I gotta get rid of something. Okay, 1, 2, 3. Okay. I think that's pretty good. I'll send it to Kate and Star and we'll get it out to you guys with the recording. Please ask your hub members to watch this recording so all the hub members get to know what they missed and get educated on health, equity, implicit bias, and all the updates and Julie's presentation, all of that. So thank you so much. Kate, any closing words? Okay,
Nope,
great
that was
job.
fantastic.
Fantastic job. And all of our skills training are on our website for anybody in the world to watch. So
Thank
every
you.
month we do a skills training, Julie, and often they're led by teams, and they're all under initiatives under our website. Great job. Such a great presentation from all the members of the Health Equity Hub. Really proud of you guys.